The World Health Organization saying today that the Omicron variant is likely to spread internationally. Scientists are scrambling to gather data on the new variant, its capabilities, and perhaps most importantly, how effective the current vaccines are against it. Based on early findings, the variant may be more transmissible and better able to evade the body's immune responses, both to vaccination and natural infection. Experts also say the Covid-19 vaccines may continue to ward off severe illness and death, and booster shots could be needed to protect most people. The makers of the two most effective vaccines, Pfizer and Moderna, are preparing to reformulate their shots if necessary, with Moderna's chief medical officer saying a new vaccine for Omicron will be ready by early 2022. With more is David Allen, an associate professor from the Infectious Diseases Translational Research Program at NUS's Yong Loo Lin School of Medicine. Welcome back to the show, Professor. Professor, Omicron has been classified as a variant of concern. What does this mean and how different is it from other variants of concern and interest that have emerged?
Thank you for having me. Omicron has a variant of concern, which Omicron has been designated, has genetic changes in it which predict that it will have increased ability to transmit among people. It may be more dangerous than other variants as far as causing disease, or it may escape immune defenses. It's also been found to be transmitted in more than one location, either multiple clusters and often in multiple countries. So from the WHO's perspective, who gave it the designation of variant concern, it has been shown to be more transmissible, and therefore it met its own criteria for what makes it a variant of concern. Its difference is that it has more mutations in the portion of the virus that attaches to human cells. And as a consequence, that concerns folks about its ability to potentially evade vaccines. That's not been proven yet. It's also not been shown to cause increased virulence yet, only because we're a little early yet. But we've not seen signals that it is a more aggressive variant compared to the others, say compared to Beta, for instance.
And Professor, when would that, you talk about, it's still early stages. When would it become something that we should be concerned about, something that we should pay more close attention to?
Well, it depends on who's speaking. If you're a world or a global public health official, you need to be aware today. If you're a citizen in any of the countries of the world, your action can be make sure that I'm following the usual measures to protect myself, wearing my mask, socially distancing, washing my hands, and that I've been vaccinated, and if I'm eligible and it's appropriate to get a booster. Those are the things that can be done for the citizen day to day, regardless of whether a new variant is found or we're living with the prior existing variants.
Separately, PM Lee said yesterday that Singapore is tracking the Omicron variant and may be forced to take step backs. What signs will experts be looking out for that could lead to a tightening of measures?
Well, I think what they'll be looking for initially to detect it, whether it finds its way, which it inevitably will, into our community, but we put in place steps to try to delay when that occurs. But the other things they'll be looking for is does it have an increased demand on the healthcare system? As you know, the healthcare systems in many countries are stressed, not necessarily overrun, but stressed. And so if there's additional stresses due to Omicron, that's what would certainly be looked for. And the way it would stress is the healthcare system is more people require become symptomatic or have moderate to severe disease or critical disease or die. As you know, the vast majority of people who have Delta, for instance, the Delta variant, have only had very mild or asymptomatic disease, not requiring any extra needs from the healthcare system. But should Omicron do such, then that would certainly be a signal to our public policy leaders to say we need to do something extra.
Thank you for your time and perspectives, Associate Professor David Allen from the Yong Lu Lin School of Medicine at NUS.